Have you made the decision to have a dental implant placed and need to know what's next? Let me guide you through the process. Once you make a decision to secure a tooth with a dental implant, the first step is to get a CT scan or a dental X-ray to guide the procedure. This allows your surgeon to properly position the implants, as well as measure the height and width of the bone, as well as locate nerves in the area. The procedure to place a single dental implant is typically 20 to 40 minutes and can be completed with the same dental freezing you get for fillings, or under sedation depending on your needs. Most patients are seen once, about 10 days after surgery, to check the wound, and again at 3 to 4 months to check that the dental implant has properly fused to the jaw. Once the integration of the implant is confirmed, your dentist takes an impression and places a crown on the implant. Has a sinus lift or bone grafting been recommended to you? Click on the next video.